everyone. My name is Carol Kapoka, the Executive Director at Ann Morse Natick. We are hosting a question and answer session on the COVID-19 vaccine with Dr. Michael Gottlieb, a longtime physician and member of our Board of Directors. We are extremely grateful that Dr. Gottlieb has given us his time today to talk about his clinical perspective and to answer the many questions seniors have right now related to getting the vaccine and making a decision for themselves. Welcome, Dr. Gottlieb. Please tell us a little bit about yourself before we get started.
My name is Michael Gottlieb. I am a board-certified internist and am a nephrologist as well. And I've been practicing in the MetroWest area for close to 40 years until the time I retired. I was on the staff at Brigham and Women's Hospital and subsequently at MetroWest Medical Center, both at Leonard Morse and Framingham Union for quite a number of years. And for the past 20 years prior to my retirement, was Chief Medical Officer of the hospital as well. For a number of years, I've been on the board at Ann Morse Healthcare, both for the assisted living facility and for the nursing home. And I've enjoyed my experience with the board quite a bit, and I'm very happy to help with this.
Thank you to have you as a member of our team, and thank you for your dedicated career to us. So let's jump into the questions today. We've been hearing from our residents, our families, and staff as we go through the process about getting the vaccine, and they have many questions. So let's get started. Are the COVID-19 vaccines safe?
Yes, the vaccines are very safe. The only issue with the vaccine really has been the issue of allergy. It turns out that the allergic reactions are really quite rare, and probably rarer than 1 in 100,000 patients who get vaccinated. For the Pfizer vaccine, it appears to be somewhere in the range of about 1 severe allergic reaction in 100,000 arms injected. And for the Moderna vaccine, probably a bit lower than that. But either way, it's very, very low, and the vaccines are very, very safe. And should, on the untoward likelihood of someone having a severe allergic reaction, there are medicines that are immediately available for patients so that those reactions can be treated and everybody does well.
So another question is that I know someone that got the COVID vaccine and then got COVID. Is this possible?
A couple of parts to that answer. The first part is you cannot get the virus from the vaccine. Let me back up a little bit and explain how how the vaccine is made. The vaccine is made using a technique called mRNA. And basically what you can think of is RNA is sort of like, if you remember as a kid when you made plaster of Paris molds and you poured the mixture into the mold, is the mRNA. And those are the instructions to make a certain portion of the virus particle. And that is the spike protein. It turns out that the spike protein, we've all seen these pictures in the paper of what the virus looks like. And it sort of looks like a ball that has a number of spikes sticking out of it. And it turns out that the spikes are the weak spot for the virus, so that if you can attack the spike, you can attack the virus. That said, what the vaccine does is it provides the patient with instructions to make the spike protein. The spike protein is not the virus, it is not infectious, it is not transmissible. But once you make the spike protein, you now can make antibodies against that spike protein. And when you are confronted with the real virus, you now have the armamentarium to destroy that virus by destroying the spike protein on the virus. So you cannot get the infection from the vaccine because the vaccine is not infective and does not contain the virus. Additionally, then, can you get COVID-19 after you've been vaccinated? For a short period of time after you've been vaccinated. It takes several weeks for someone to develop true immunity after being injected with the vaccine. So, for example, if in the days immediately before being vaccinated or after being vaccinated, you were to contract the virus, you could still become infected. But once once the vaccine kicks in, it would be very unlikely, and particularly after getting both doses of the vaccines that are currently available, it would be very unlikely that you would get the virus, but not impossible. The vaccines are both about 94, 95% effective, which means that 5% or so of people that are vaccinated could still get infected, but 95 people out of 100 would not. The vaccines are extraordinarily effective. Most vaccines are not nearly that effective in the 94, 95% range. So we're very, very fortunate that the vaccines are as robust as they are.
This is very good news. I've received the first vaccine and I'm looking forward to getting my second vaccine on Saturday through our clinic at Ann Morse. But I'm wondering if I get the vaccine, as I have, can I still transmit COVID-19? And do I still need to wear a mask?
There is still probably quite a bit more that we need to learn about the infection and about the virus. What we know is that the likelihood of transmitting the virus is unknown. And so it may well be that once you're vaccinated and become immune, it is unlikely that you would transmit the virus, but we don't know that for sure yet. What we do know is that you won't get sick, but we don't know whether you can still harbor the virus and transmit it to other people. So the current thinking is that even though you've been vaccinated, you need to wear a mask and you need to engage in precautions as if you were still possibly infectious.
So another question, if I have food or other allergies, is the vaccine safe for me?
Yeah, it turns out we've talked about allergy before, about severe allergic reactions. And most standard vaccines previously were made with virus that's injected into eggs. And so an egg allergy with other vaccines used to be a reason for not getting that vaccine. With these mRNA vaccines, they're not made with eggs. They have nothing to do with eggs. And so an egg allergy is not a reason not to get vaccinated. Additionally, food allergies don't appear to be related to the severe allergic reactions that have rarely been seen with getting the vaccine. So that said, we can be pretty confident in saying that people who have food allergies or even other medication allergies generally would be able to receive the vaccine without worrying about getting themselves into serious trouble.
Thank you. So a question, if I've already had COVID-19, why do I need to get the vaccine?
Again, this is something that is an area where we are still in a place where we don't have all the information. The immunity that one gets from having been infected may be transient. It seems to be transient in a few people. In other words, there have been cases, not many, but there have been cases where someone is infected and then months later gets infected again and has a second illness. Those cases are extremely unusual, but they have occurred. So it's not clear how long the immunity from being infected with COVID-19 lasts. It may last in most people for quite some time, and what quite some time means is unclear. Is it months? Is it years? We don't know. And so it is felt that the prudent path at this point, with our current state of knowledge, is that patients who have had the virus infection, have had COVID-19, should still be vaccinated, as that will provide them with greater protection.
The idea of current state of knowledge is interesting because we are learning more and more every day about the vaccine.
Sometimes our recommendations change, and it's not because we didn't know what to say, but because as the knowledge base increases, we're able to more sharply focus the correct information. So it is still all in a state of flux.
Will we need to get the vaccine every year?
So at this point, it appears that the immunity lasts at least for many months. It may, in fact, last for several years, but we don't know that at this point. And so the current thinking is that there is no known information about whether a booster shot would be needed years down the road or not. It may be that boosters will not be needed. The other thing to think about is that as patients receive the vaccine in larger numbers, we start to develop what is called herd immunity, where once 80-ish percent, maybe a little less, maybe a little more, 80% of susceptible people have developed immunity, either from previous infection or from receiving the vaccine, and preferably from receiving the vaccine. Once you get to about 80% of a population, it's very hard for the virus to take hold in a population, in a community, because there are not enough fertile donors, not enough people who still could be infected. And so the virus tends to die out, does not become prevalent in the community anymore. That's pretty much what happened with lots of infectious diseases, including polio, measles, a number of diseases, which once sufficient numbers of people in the community are vaccinated, the disease tends to disappear.
We're hearing about different variants or different strains of the virus. Do we know if the vaccines are good to safeguard us against these new variant strains?
There is a strain that people are somewhat concerned about because it appears to be at least more easily transmitted than the standard strain of the vaccine, and that's the one that was discovered in Great Britain. That strain appears to be very susceptible to the vaccine, so there doesn't seem to be an issue there. There is a second strain that has developed in South Africa, and it appears that the South African strain may not be quite as susceptible to the vaccine as the previously known strains. That said, it is still susceptible, but probably not at the 95% range. We don't quite have a number yet to put on that, but maybe it's in the 70, 75% range or somewhere in there, or possibly lower, but we don't know yet. At any rate, it appears to be effective, but not as effective for that particular strain. That said, there are going to be many, many more strains. The virus keeps changing. And as the virus changes, we need to keep up with what it's capable of doing. But the best way to prevent the virus from changing is to eliminate the virus from the community. So if everybody were to get immunized, then the virus would not be around and wouldn't be prevalent, and therefore would not be afforded the opportunity to mutate and to become different from what it was.
This is all wonderful information, but if I wanted to learn more, where is the most reputable, the best source of information? Where can I go?
You need to get your information from a reputable source. And the reputable source for COVID-19 information is the Center for Disease Control, the CDC. And the CDC has its website, it's cdc.gov, and you can get great information there. In Massachusetts, we also have a state site which will provide links to the right information as well. So you can go to mass.gov/COVID-19 and also get great information. But get your information from a reputable source. Don't get it from your cousin who heard from their cousin about something that happened to somebody who took the vaccine and then had some bizarre effect. The vaccines are safe. They are highly effective. They are using a technology that has been proven over years, and it is extraordinarily important that you get the information from the right source, because otherwise it's very, very confusing and it can be very frightening.
I think you really answered this next question about the idea that family, friends, people that we know, people that we talk to think that the vaccine was developed too quickly. And, that might give someone a recommendation, you should wait. I don't think it's a good idea to do that now. So really, what should they do?
It is true that the vaccine in the final stages was developed rather quickly. Over the past 20 years, scientists have developed the technology to be able to make these types of vaccines, these mRNA vaccines, which provide the instructions for making a piece of the virus, but a non-infectious piece of the virus. And so it's very, very easy to change and make a different piece of the virus, because you have now the ability to do this, and it's easy to change as compared to the old style way of making vaccines. So, for example, going back to if a strain were to develop that was not susceptible to the vaccine, the scientists would be able to go back and create a vaccine that was effective against the new strain, and could do that very, very quickly. That said, everything that we know about the vaccines tells us that they are safe. They are not infectious. You cannot get the virus from the vaccine, and there really is no point in waiting, because there is risk in everything we do, but there's also risk in everything we don't do. So if you don't take the vaccine and you do wind up with a COVID-19 infection, many people will get mild or no illness at all. And in fact, 50 or plus % of people who get infected with the virus don't even know they have it, or have very, very mild symptoms, maybe nothing more severe than what seems to be a cold. That said, people who get really sick, it's very hard to identify them at the front end. We know about some risk factors for severe illness, but there are many, many people who have had no risk factors and who are not elderly, who wind up getting severe disease. And there was no way of predicting whether those people were going to get severe disease or not. Now, we do know that older people are more likely to get into trouble than younger people, and that people who have other comorbidities like severe heart disease or lung disease, or whether they're immunocompromised, where they have other illnesses that maybe make their immune systems not as competent as a normal person. We know about all of those things as being making people more susceptible to severe disease. But that said, there are still, as I've said, lots of other people for whom we did not know that they could develop severe disease, who do develop severe disease. So it is clearly better to be vaccinated than not to be vaccinated.
Great answer. And we'll wrap it up with one last question, given us a lot of information to consider. But just if someone was still on the fence, what might you suggest they do right now?
I would suggest that as their group becomes available to be vaccinated in Massachusetts, that they get vaccinated. There are a number of new sites that are going to be opening up over the next week, actually, for people who are 75 and older, and then for people who are 65 and older, and then for people who have 2 or more comorbidities. And so that's the next group to be vaccinated. And that should begin actually February 1st. There are many, many people in Massachusetts who do want to be vaccinated. Now, you look at other parts of the country, and there are people who are being a little more cautious about signing up for the vaccine or taking the vaccine. But in Massachusetts, most people, I think it was the number I had read was greater than 80% of people who would be offered the vaccine would take the vaccine. That said, there is good demand, and currently there's not great supply. So I would strongly suggest that when you are offered the vaccine, you take the vaccine, and that you sign up for getting the vaccine at a site close to you. There are going to be CVS pharmacies doing this. Various town health departments will be doing this. Hospitals, a variety of different venues where you'd be able to get the vaccine, including many physicians' offices. So get vaccinated as soon as you can get vaccinated, and it is absolutely the right thing to do.
Great. Thank you, doctor. Thank you for sharing this important information with us. And as we know, if people have any additional questions or thoughts, they can go, as you recommended, to the cdc.gov or the Massachusetts website that gives us credible information. So on behalf of Ann Morse Healthcare Corporation, we thank you. We thank the folks in the audience for watching this video today, and we're hoping for everyone for a healthy and safe 2021. Thank you all.